Welcome to Chapter 5 of Essentials of Healthcare Finance, Community Benefit Assessment. This chapter focuses on the increasing attention being given to the community benefits provided and received by not-for-profit healthcare firms, especially hospitals. Almost 60% of all non-federal hospitals in the United States are not-for-profit hospitals, which means that they are exempt from federal income tax. This tax exemption is the lightning rod that has attracted public attention. This chapter is divided into 5 major sections, which are described as tax-exempt status, areas of community benefit, measuring community value, the community value index, estimating financial benefit received, and estimating financial benefit provided. The learning objectives are to describe the current basis for tax exemption of not-for-profit healthcare firms, describe the elements of community benefit listed by key policy groups, assess the relative community benefits provided by proprietary and not-for-profit hospitals, and develop a methodology for estimating financial benefits received by not-for-profit healthcare firms, and finally develop a methodology for estimating financial benefits provided by not-for-profit healthcare firms. Not-for-profit hospitals comprise 78% of U.S. hospitals and are not subject to federal income tax, or most sales taxes or property taxes. In most states, they sell tax-free bonds, making it cheaper to fund building projects. In a report issued in December of 2006, the Congressional Budget Office estimated nonprofit hospitals receive $12.6 billion in annual tax exemptions, on top of the $32 billion in federal, state, and local subsidies the hospital industry as a whole receives each year. And with that, healthcare costs are rising. In a report issued in December 2006, the Congressional Budget Office estimated from a 5-state survey that nonprofit hospitals provided 0.6% more in uncompensated care than for-profit hospitals. Not a whole lot. There are some court cases on not-for-profit hospitals' tax-exempt status. For instance, in March of 2010, the Illinois Supreme Court upheld a denial of property tax exemption. And there are many states that are requiring more effort to be put forth by the not-for-profit hospitals, such as a detailed community benefit requirement, which 10 states have, and a less detailed community benefit requirement that about 15 states have for not-for-profit hospitals to demonstrate. The IRS recognized 5 factors that would support a nonprofit hospital's tax-exempt status. 1, the operation of an emergency room open to all members of the community without regard to ability to pay. That's true for any emergency room, just as a point of order. Number 2, a governance board composed of community members. 3, the use of surplus revenue for facilities improvement, patient care, medical training, education, and research. 4, the provision of inpatient hospital care for all persons in the community able to pay, including those covered by Medicare and Medicaid. An open medical staff with privileges available to all qualifying physicians. The Patient Protection and Affordable Care Act, ACA of 2010, has an additional requirement for charitable exemption. Meets the community needs assessment requirements, which is they conduct the assessment at least once every 3 years. They adopt an implementation strategy. They get input from the community and make everything available to the public. They establish a financial assistance policy for medically necessary and emergency care, and develop, follow, and communicate a formal charity care policy. Additionally, it must meet the required limitations on charges. Limit charges to emergency and other medically necessary care to the lowest amount for individuals with insurance. It prohibits the use of gross charges. It meets the billing and collection requirement, does not engage in extraordinary collection efforts until financial assistance policy eligibility is exhausted. Here in this graph, you can see where the current dollars are as it relates to the state analysis of charity care cost. You see Texas with 5.3% of charity care costs, 14.7% of bad debt, 5% of unreimbursed cost of Medicaid, and 13.3% of unreimbursed cost of Medicare.